One, what is the need? 47 million Americans have no health insurance. When Hillary and Bill Clinton tried to get health insurance, we said, my God, 30 million Americans have no health insurance. 15 years ago. Now it's 47 million. Point one. Point two, 55% of all people in this country who file for personal bankruptcy file for bankruptcy because of health care costs. And of the people who file for bankruptcy because of health care costs, 75% have health insurance.
Yeah.
And they had that health insurance, which was excellent health insurance, until they needed it. And it wasn't so excellent anymore. It didn't cover their expenses. Something's happened. So we need to fix the system. It's broken. And you've heard the horror stories. We know all the horror stories. We need to fix the system so it's broken. The insurance companies have people, many people, thousands of people, whose only job is to try to figure out some excuse for not paying your bill.
Yeah, that's right.
If you pay health insurance for years, and suddenly you get some expensive illness, God forbid a brain tumor, some expensive illness, they will look to see if they can find some excuse for rescinding your policy. When you were asked on that insurance form 15 years ago, did you have a pre-existing condition? You didn't list the high school acne. So now they're going to rescind your insurance, they're not going to treat the cancer. We're going to prohibit precisions. Second, they look, and they look to see, can they deny treatment? The bill that we have in front of us, and we have several bills, I'm talking about the House bills. The three House bills are broadly similar, with a few crucial differences. One, they will say that every employer except very small businesses must provide health insurance, and certain minimum standards of what health insurance means. Must provide health insurance to their employers or to their employees, or if they don't want to, pay into a fund which government will use to provide health insurance. Pay or play. Second of all people will have to purchase health insurance if they don't have it. And that means the 25-year-old who thinks he's indestructible till he's hit by a car, comes down with a disease, will have to purchase health insurance or pay an extra tax. Third, we will subsidize people who are low and moderate income to help them pay for the health insurance premiums. We will expand Medicaid for really poor people, and for people above the Medicaid level, up to 400% of the poverty level, which means $88,000 for a family of four and about $44,000 for a family of one. We will subsidize you for the premium. You'll be able to get some government money to help you pay the health insurance premium on a sliding scale. If you're making $20,000, we'll pay the whole premium. If you're making $88,000, we'll pay very little of the premium. If you're making $90,000, we won't pay the premium at all. But so everybody, the insurers will have, the employers will have to give health insurance or pay into a fund. Individuals will have to buy health insurance or pay into a fund, and we will help individuals pay for the premium if they need the help. That's the basic outline. We will also say to health insurers, one, no rescissions. You can't rescind the policy for some alleged ancient sin. Second, we will say, you know, you can get sick and you think you have good health insurance, but there's almost always an annual or lifetime limit. You know, the insurance company won't pay more than $1 million. Well, if you get some very expensive illness, you can hit that lifetime or annual limit. So no more annual and lifetime limits. Out. Thirdly, you get an expensive illness, the insurance company's going to pay 80% of all the costs, but that 20% can bankrupt you. Right. So we're now going to say that no matter what else the insurance policy says, out-of-pocket expenses, co-payments, deductibles, etc., cannot exceed $5,000 in a year for an individual, $10,000 in a year for a family. All these are very good. If you don't get health insurance from your employer, if you're a small business person, if you're self-employed, if you're unemployed, if you're insured, if your company elects not to provide health insurance, you can go into this new government market we're going to set up called the exchange and purchase a health insurance plan at group rates, not individual rates, with no rescissions, no pre-existing conditions anymore. Get rid of that too.
Good.
You can go into this exchange, which is a government-run market, and buy a private health insurance from Cigna or Prudential, whoever, or the public option. The public option will be one option, that's why we call it an option, available to you on the exchange. You can buy from Cigna, you can buy from Blue Cross, or you can buy from the public option. Insurance companies are going crazy to defeat this public option. It is the issue now, besides all the nonsense about non-existent death panels and all that other nonsense. But the real issue is the public. The real issue is the public option. Why? Because the only thing that will keep the insurance companies honest, the only thing that will keep their costs down, is the competition from the public option. Every time the public option is thrown into doubt, every time it looks like we might not get it, the stock prices on the insurance companies go way up. And when the president comes out and says, no, we're going to have a public option, they go down again. That, to me, is the proof positive why we must have the public option. If you take out the public option, what are we doing in this bill? Everything I just said, think about it a minute. Everything I just said, what are we doing in this bill without the public option? We're doing some very good things. But how are we doing it? By throwing hundreds of billions of dollars at the insurance companies. Here, we are going to mandate that 25-year-old kids who don't want to buy insurance from you, buy insurance from you. Anything wrong with that, Mr. Insurance Company? We're going to mandate that the employer buy insurance from you. And if he doesn't, he's going to have to pay into a fund, and we'll use that fund to have people buy insurance from you. We're going to greatly increase the customers of the insurance companies. They love it. But it'll bankrupt us. The system will be unsustainable if we just throw hundreds of billions of dollars at the insurance companies. Plus, there'll be nothing to mandate their cutting, to prohibit their cutting corners on treatment. And for everything we prohibit, they have very creative minds. They'll find some other things that we haven't thought of prohibiting yet. And they'll do some other terrible things. So the public option is absolutely essential to keep the insurance companies in check and to keep the costs sustainable. We spend in this country today 17% of GDP of our entire economy on healthcare. No other country in the world spends more than 9%. Most countries spend under 6%. And we've gone to 17%. The projections are we're going to go to 30% in 20 years. That means 30% for healthcare, everything else for everything else. Education, transportation, housing, entertainment, the military, you name it. The food, you name it. Everything else, 30% healthcare. We can't, no society can afford that. We've got to rein in that cost. And for all the money we're spending now, 17%, we're 47th in life expectancy in the world. 47th. A Japanese person can expect to live 4.5 years longer than an American at birth. A Canadian, and they have that terrible single-payer system up there. A Canadian can expect to live 2.6 years longer than an American. A Japanese, even a French person can expect to live 2.1 years longer than an American, and they drink all that wine. Maybe that has something to do with it. And now let me get to the politics of this.
All right.
We are being told, it's obviously being set up in such a way, that the House is going to pass a bill with a public option. We will. And the Senate will pass a bill, if they pass a bill, without a public option.